Good day, lovely people. I welcome you to the Diet and Disease Show. Our mission here is to bring you insightful health tips whenever we meet. And today we are here to give you all. Today, our topic might be a bit scary, but very important for every woman out there who is expecting or planning to have a family. That's overt diabetes. Have you heard of it before? I doubt not. So, joining me today are panels of experts in science of nutrition and dietetics, and I am delighted to welcome my guests. So, today I have with me RD Kenneth, RD Sandy, RD Ohiniwa, RD Elvis, also known as Obolo Dietitian, and I also have RD Prisla with me. So, and I am Donko Mercy Ashley, your host for today. So let's go for a quick break, and when we are back, we will delve into what overt diabetes is. Okay, welcome viewers. As I said earlier, our topic on board today is overt diabetes. But before we start, let's establish some foundation. The basic, what is diabetes? Now, diabetes is a leading chronic challenge in Ghana, and currently over 587 million people live with this kind of condition. So, and most of us too, we don't know much about it. We just heard the name diabetes, diabetes, diabetes. So let's go to our RDs. I'll start with RD of this dietitian Bolo. What actually is diabetes? So is it diabetes? What is it?
Okay, thank you for having me here, and also ecstatic to be here. So when I talk about diabetes, I want to make some scenario before I came into my main quest. So think of your body like a car. Pairing glucose and sugar is the fuel, and insulin is the key. That allows glucose to enter the car. So in diabetes, either the body is not making enough insulin, this is the key, or the lock isn't working. So the sugar will just relax and sit our body, which is like leaking fluid all over the engine instead of being used for energy. So over time, it will damage our organ. So we all know that in our body, glucose is the main source of energy for the cell, and insulin help the glucose to enter those cells. So in diabetes, when insulin is not working, the glucose remain in the bloodstream instead of nourishing the cell, will cause low energy in the cell and hyperglycemia, which is high sugar level. So over time, it will cause damage to our organ, which is our kidney and the eyes. Yeah, thank you.
Thank you very much. I really like the scenario that you gave. Like your body as a car, the
This
insulin.
is the key. Yeah.
So thank you. But do you know, RD Elvis, most of us, you paid the term like type 1, type 2 diabetes. But when it comes into like when pregnancy comes inside, it's a bit confusing. Some and other complication comes inside, it's a bit confusing. So can you help us with the types? Break it down for us to understand, I and my viewers to understand it well.
Okay, thank you. So in diabetes, we have many types. We have type 1 diabetes, type 2 diabetes, and gestational diabetes. When it comes to type 1 diabetes, it's inability of the pancreas to produce no or enough insulin due to autoimmune attack on the beta cell of the pancreas. So it means that our body is not making enough insulin. When it comes to type 2 diabetes, is also insulin resistant. It's inability of the cell to respond properly to the insulin. It means we have insulin in our body, but the insulin is not making his or her work. So this type is most common, and it's usually linked to our genetics, our lifestyle. When you talk about lifestyle, is with the food we eat, exercise. When it comes to gestational diabetes, that one is a prime, it's a unique. It starts during pregnancy, usually at the second and third trimester. So at this type of diabetes, and in pregnancy, the state of insulin resistance due to the placenta reduce some hormones. That is the hormones placenta, lactogen, cortisol. So these hormones reduce the sensitivity of the maternal tissue which is like muscles and fat to insulin. Thank you.
Thank you very much. So the type 1 is when the body or the pancreas can't produce the insulin at all.
Yeah.
And the type 2 is when it produces it, but it can't utilize it. Okay. And the gestational counts in when pregnancy is.
Yeah.
Okay. Now that we are done with the basics, let's go into our main topic for today. That's overt diabetes. Okay. So what then is overt? Because when we were even mentioning the types, you didn't add that one to it. What is it? Is it just a fancy name for any of them, or is a condition on its own?
Sandra, can you help us? Thank you for the question. So I'll say that it's just a misconception, yeah, about like a fancy name where you say in this community. So when you talk about overt diabetes, it's when a woman comes in for a very first checkup, yeah, and also it's within the early 8 weeks, and also and when the blood sugar is also very high, when it's very high.
So you want to tell me, like, I'm a bit confused here. Let me say type 5. So the over 2 is diabetes in pregnancy, yes.
But she likely had type 2 diabetes before she got pregnant.
Okay, it's me. So the condition was there, but it was not identified or was silent. One that is silence. Okay, okay. Well, thank you very much. And so, how do you, Kenneth, can you help us the difference between the two, the gestational diabetes and the Robert's diabetes?
So thank you and greetings to viewers too. So with the gestational diabetes and the overt diabetes, they are both first diagnosed in the first trimester of their pregnancy, but they both differ when it comes to the heart severity. So we realize that um somebody having overt diabetes is more severe compared to that of the gestational diabetes. Okay, so both overt diabetes and gestational diabetes in pregnancy are hyperglycemic conditions first recognized during pregnancy, but they both differ in their severity. So overt diabetes is more severe form of hyperglycemia. Yes, it's more severe form of hyperglycemia associated with worse maternal and fetal outcomes, leading to embryopathy. Yes, and also they differ when a test called fasting plasma glucose test is done. So with that of over diabetes, when a pregnant woman who is diagnosed of when a pregnant woman goes into that test, you realize that he, her, cast, her fasting plasma glucose levels ranges from greater than or equal to 7 millimole per liters, and that of the gestational diabetes on ranges from greater than or equal to 5.1 to 6.9 millimole per liters. So that's the little differences we have. Thank you.
Thank you very much, Heidi. Heidi and Naya, can you add something small about the difference?
Okay, so thank you very much. So as my sister said, RG Sandy said it, and we all know that obese diabetes is it's just the regular diabetes that we know, right? But then it's like it's not discovered. So just the normal type 1, type 2 diabetes. But then just that it's not really discovered until the pregnancy shifts in. So it's like a hidden diabetes, let's say a hidden diabetes. So as she said, it is discovered at the first
First trimester.
first trimester of pregnancy. And then the overt diabetes is very crucial. Comparing it to the gestational diabetes. So you see that the gestational diabetes like this, after the pregnancy or after the mother gives birth, it will go. Okay. But then the overt diabetes, if it's not properly managed, can lead to other complications such as type 2 diabetes. easy and it's there.
Thank you very much. So it means that this offense is serious than
Very serious to both the mother and then the child.
Oh, okay. I'm really learning a lot today, and I hope you two are also learning a lot. And I haven't heard of this overt diabetes until last week that I heard the term. And I didn't know it was serious like that until this conversation. So, and I heard RD Kenneth say something about diabetic encephalopathy. It sounds a bit scary in my ears. So, RD, please, can you help us with that word? Diabetic encephalopathy.
What exactly is that? Thank you. Good evening to everyone. Please, diabetic embryopathy it's visually means the disease of the embryo. So with this case, the mother already has the diabetes, but the mother was not diagnosed. And then through her pregnant journey, she went to the hospital and then diagnosed with the overt diabetes. So it is actually going to affect both. It's actually going to affect the placenta, and it can result in many birth defects such as it can affect the nervous system. So when it affects the nervous system, it comes with diseases or conditions like spinal bifida and anencephaly. So the spinal bifida works with the spinal cord. So anything about the nervous system is about the brain and then the spinal cord and the rest. So about the spinal bifida, you see this mother will give birth to this child and then the baby's spinal cord will be unable to close due to the condition. And with the anencephaly, so anencephaly is where the brain is on the brain is unable to develop well. So it's actually not fine in Ghana because in Ghana, we have not met such cases before, but in the outside world or Western world, you realize that they will give birth and then half of the head is cut off. It was due to the brain development because the brain was not developed well. And then when it comes to complications that is related to the child. So some of the complications I've already mentioned one, and then we have one like microstomia. So microstomia is when the child becomes big in the womb. So this is what actually happened. You see, there is more glucose in the blood, in the woman, and the insulin do not want to release the nutrients the nutrients to the bloodstream. So the glucose will be stuck or tacked. So due to that, the fetus will try to produce its own insulin. Due to that, it leads to it makes the baby become big during, I think it's during the third trimester. So you realize that when they give birth to the baby's skin becomes saggy. I mean, the skin will become membrane when it touches. In the normal sense, when we give birth to a baby, the skin is supposed to be tough because there is muscle building and all those kind of things. And then it can lead to surgery for the mother's side. They can perform a surgery because imagine you giving birth to a big baby and you cannot push. So they have to perform a surgery, and then a surgery has its own complications and all that. And we talk about the skeletal system being formed. So during the first trimester, sugars are stuck in the mother's womb, and the placenta and the fetus will have to they will have to produce their own insulin, and it becomes more like the weight become load, like everything be loaded in the womb. So due to that, everything like forming of the bones and all these things will be complicated or be difficult for the baby to come out with it. So sometimes you will give birth to a baby and then the baby immediately the baby or hands will be like in this shape. I think all of this is sometimes we face these things in our community, but it's because we don't take care of it. Because you are pregnant, you don't feel like going to the hospital. So how would a doctor be able to identify that you have this ovate? And mind you, this ovate is not common in Ghana.
Yeah. And many of our even said, yes, not heard it before. And so I think last week, And I heard they saying, I said, no, wait, and so and let's discuss it.
Yeah, so
But then, sorry, not to cut you off. I think most of the pregnant women, especially those in the rural areas, they refuse to visit the hospitals for prenatal care because for money. They think that probably they don't have money. That's why when you come to the health sectors, it's not just the doctors, the nurses, the dietitian that works. We have other workers, we have the social workers who are also there to help such people. So please, if you are out there, you get pregnant, don't say that I do not have money, so I can't go for prenatal care.
So, okay, please continue.
and over to you see, it's not only the mother and the baby that is going to be affected, but the mother too can get some complications, because imagine performing surgery and then it can lead to bleeding
Is that
and so at some point, if it is not well managed, the mother can turn out to get hypertension. Yes, because me, one thing I know about diabetes is if you don't manage it well, it leads to hypertension, and then you have a lot of work to do because of whatever that you are going to. So that's what I'll talk about. And then mind you, over 2 leads to stillbirth. So yes, so right now the baby is big in your womb, and then the sugar is you the mother. Your insulin is producing more sugar or glucose, and then the baby's own too is producing more glucose in the womb. So because your for the mother, the glucose will not be released to the child. You see, mothers when we eat, the placenta is the way that the baby can get nutrients from it. But right now, everything is blocked. Do you get it?
Yes.
So whilst it is blocked, the baby, the fetus, we tend to produce its own insulin so that the fetus can get it. So it will meet. And then you see, if let's say fire meet, it turns out to be something. Yes, so it can lead to stillbirth when it's not managed well. And mind you, please, your first trimester, you have to be going to the hospital. The hospital, we have designed hospitals to be a place that, apart from church, hospital is the next step. Do you get it? You don't have to stay home, be your own medical doctor. These things, they are hidden. You cannot see them unless you go to the hospitals, because we are trained on that particular field. Yes. So that you and I have about.
Thank you very much, RD Pesla. So all these complications because of over diabetes, okay. But today I have a room filled with RDs, and I'm not letting them go until they tell me what actually happens in their office when someone is diagnosed of this overt diabetes. What role do they play in with the person's life? Why should the person even comes to them? Okay, so RD, can you help us?
Oh, okay. So we dietitians play a crucial role when it comes to management of overt diabetes. So we mostly encourage patients who are of overt diabetes to eat foods that are rich in fiber and foods that will help control their glucose or sugar levels in their blood. So most of the time, high fiber foods are one of such that we entertain patients who are of such disease, over diabetes, to take in. Such food includes vegetables like contomere, cabbages, carrot, green, green ayoyo, yeah, our natural home. Yeah. All those stuffs contain certain fiber that helps control our sugar levels in the blood. We also entreat that patients will go away from eating foods that are refined. Yeah, refined foods are high in, let me say, sugar, high in sugar. So mostly when patients it takes in, their sugar rises fast compared to somebody who would take in fiber-rich fish. Yes.
Let me okay. Yeah. So sometimes most of our people, they'll come when you ask them to come to the diet healings, they will be like, you are going to direct us on food or going to help like manage the blender we use to pay. Sometimes they don't know the importance of this food that they are eating. And you see, for our mothers, especially when we are preparing nkatenkwan and light soup, especially ahokonfai, they tend out to remove the fiber that is needed in the food. Or no, they tend out to sieve it from the and they remove the chaff and throw it away. But that's the most important thing. With obet, we use fiber. You see, with diabetes in question, it is the fiber that is going to how control the sugar levels. Do you get it? It's like you eating and blended watermelon, and then somebody eating orange, the raw watermelon without it being blended. You see that the digestion process would differ because with a blended one, the it will just go straight to your bloodstream. The digestive system won't have any job to grind something or something. But with the normal watermelon, everything had to go through its process. So within 1 hour, you see that this one has been digested with the blended one. But within within 2 hours, that's when you realize that the raw one has been digested. It's because of the fiber. So that's what we are much interested in, the fiber, not the food itself. Because if you are going to eat fufu, you pound the fufu from its solid state to become something fluffy or something. Yeah. But if you are going to eat the soup, even though you have blended the soup, but there should be more fiber. That's why in Tia 34 they are much healthier than us, because for them they do otobum shegu, which is very healthy. Yeah, so Aggie can continue.
Okay, so as she has already said, let me put this one down. That of spices. When it comes to spices, we have natural spices and artificial spices. So we entreat the natural spices, which includes the onion, the ginger, and garlic and other stuffs. But with a refined one, which I wouldn't like to mention the name because it's somebody's product, he entreat that we will stay away from that because all those kind of spices rises our sugar levels. Yes. So this and many more, together with other work, health care services, um, we help treat or control over diabetes.
Thank you very much, Tardy. So it means that when it comes to you are not going to teach us how to cook.
No.
Because most of us we take that we have diabetes teachers and we can actually give you the recipe. Yeah, sometimes the way people cook, they will turn out to like the nitrate. They think that they have to cook. So I not coming there to tell you recipe. For instance, when you are cooking egg, some people turn out to overcook the egg. Okay, so you need but what I know, when you cook egg, the yolk is supposed to be yellow, not that brown. When you do that, you have denitrate the egg. Do you get it? So sometimes if the RD is interested, and you see, if you want to make exceptional in your work, the person can go ahead and then teach you how to. And you can come along. You can meet somebody that do not know how to cook. You can just give out the recipe. And sometimes the way we cook, like somebody who you eat fruit salad is not good. We are not interested. For dietitians, we are not interested with fruit salad. We just want you to be eating one fruit. If you want to eat it in a day, but it should be one. Do not miss the fruit. So these are all some small recipes that we can eat. So we can tend to give you, and in the situation that the person is being admitted in the hospital, it can be, you can actually make some blended meal or fortified meal. You see, most of us who don't know about this blended meal and the fortifying meal, so you can go ahead and then give the procedure if necessary. Okay. Thank you very much. We've covered a lot today. We've covered a lot, and I'm learning a lot today, and I hope you too are learning. So when we started, our artists were saying that the overt is diagnosed at the early stage of pregnancy, right? Yeah. So I want to know if I'm out there hesitating to go to the hospital, waiting maybe at the later journey of the pregnancy, that's when I would decide. What advice can you give me to such a person? because I think that will also help them. Adi and no, sorry, Anaya, please can you help me?
Okay, so to my young ladies out there, to my women out there, we know that the life is not easy. And then the first week of pregnancy can be alarming. That one I know for sure. But please don't hesitate to go and see a health worker when you get pregnant. Because as we stated earlier, overt diabetes is detected in the early stage. When you hesitate to go and see the dietitian and then you go maybe in the later part, it will end up being a gestational diabetes. So as you are out there, don't hesitate to come and see us. As my sister said, we are not here to judge you on foods that you are eating. We are just here to help you. Remember, your baby your baby is building its body, the brain, the spine, and all the other essential parts. So your body is serving as a home for the baby. If we don't take care of it, then it is going to affect the baby, like the dangers that we mentioned. So don't stay out there. Come for us to help you build a better home for your baby's development. Thank you.
Thank you very much, Adi. So as Adi said, the baby organs is building at this stage. So don't hesitate and don't stay in the house. Prenatal care is not a good idea. It's a life-saving journey that you take. Okay. So and the over diabetes is not just a fancy name. It's a very serious condition that can lead to several complications, as our RD said. Okay, so today we are bringing our talk to the end, and a special big thanks to all our RDs here. We are really honored to have you here, and a big thanks to all of you out there for supporting our show. We ask you to stay healthy and stay strong for us, and we'll see you in our next episode. Thank you. Bye bye.